Non-alcoholic fatty liver disease (NAFLD) is a condition characterized by an accumulation of excess fat in the liver in individuals who consume little to no alcohol. NAFLD is becoming increasingly common worldwide, particularly in Western countries, due to the rise in obesity, diabetes, and sedentary lifestyles. It encompasses a spectrum of liver conditions, ranging from simple fatty liver steatosis to more severe forms like non-alcoholic steatohepatitis (NASH), which can lead to liver fibrosis, cirrhosis, and even liver cancer. Key points: NAFLD spectrum. NAFLD includes two main conditions. Simple fatty liver steatosis, fat accumulation in the liver without inflammation or damage to liver cells. This is a milder form of NAFLD and is generally considered non-progressive. Non-alcoholic steatohepatitis (NASH), a more serious form of NAFLD, where fat accumulation is accompanied by inflammation and liver cell damage, which can lead to fibrosis, scarring, and increase the risk of cirrhosis and liver cancer. Prevalence: NAFLD affects approximately 25 to 30% of the global population, with higher rates in individuals who are overweight or have type 2 diabetes. Causes and risk factors. While the exact cause of NAFLD is not fully understood, it is closely associated with metabolic syndrome and conditions such as obesity, particularly central obesity, excess fat around the abdomen, type 2 diabetes. Insulin resistance is a key factor. High cholesterol and triglycerides. Dyslipidemia is common in people with NAFLD. Hypertension, high blood pressure. Polycystic ovary syndrome (PCO) is a hormonal disorder in women. Sleep apnea, often linked with obesity and metabolic syndrome. Genetic factors. Certain genes, such as PNPLA3, are associated with an increased risk of NAFLD. Symptoms. NAFLD is often referred to as a silent disease because many people have no symptoms in the early stages. When symptoms do occur, they may include fatigue, a common symptom in more advanced stages of NAFLD, discomfort or pain in the upper right side of the abdomen where the liver is located, enlarged liver hepatomegaly, which may be detected during a physical examination. In more severe cases, where liver damage has progressed, NASH or cirrhosis symptoms may include jaundice, yellowing of the skin and eyes, swelling of the abdomen due to fluid accumulation, ascites, confusion or drowsiness, hepatic encephalopathy, easy bruising or bleeding. Diagnosis. NAFLD is often discovered during routine tests, such as liver function tests, which may show elevated liver enzymes ALT and AST. However, these tests alone cannot diagnose NAFLD. Additional tests include imaging studies. Ultrasound, a non-invasive test that can detect fat in the liver. It's commonly the first imaging test used to diagnose NAFLD. CT scan or MRI, more detailed imaging can be used to assess liver fat and damage. FibroScan transient elastography, a specialized ultrasound that measures liver stiffness to assess fibrosis and fat content. Liver biopsy, the most definitive way to diagnose NASH and assess the degree of inflammation and fibrosis. However, because it's invasive, it's not routinely used unless there's a strong suspicion of advanced liver disease. Blood tests. Fibrosis tests. Non-invasive blood tests, such as the FibroTest or NASH FibroSur, can estimate liver fibrosis. Metabolic blood panels, to evaluate cholesterol, glucose levels, and markers of metabolic syndrome. Assessment of risk factors. Doctors will also evaluate the patient's weight, blood pressure, blood sugar, and cholesterol levels to assess the likelihood of NAFLD. Stages of liver damage. NAFLD progresses in stages, and not all patients will advance through all the stages. Steatosis, simple fat accumulation in the liver. NASH, inflammation and liver cell damage in addition to fat accumulation. Fibrosis, Persistent inflammation leads to scar tissue forming in the liver. Cirrhosis, extensive scarring that impairs liver function and can lead to liver failure. Liver cancer. In some cases, cirrhosis can lead to hepatocellular carcinoma (HCC), a form of liver cancer. Treatment. There is no specific medication approved to treat NAFLD, so the main approach is lifestyle modification and managing underlying conditions. Lifestyle changes. Weight loss. Losing 7 to 10% of body weight can significantly reduce liver fat and inflammation. Even modest weight loss can improve NAFLD. Healthy diet. The Mediterranean diet, rich in fruits, vegetables, whole grains, and healthy fats like olive oil and nuts, has been shown to improve NAFLD. Exercise. Regular physical activity. At least 150 minutes of moderate intensity exercise per week can reduce liver fat and improve insulin sensitivity. Managing risk factors. Control blood sugar. Managing diabetes with diet, exercise, and medication can prevent the progression of NAFLD. Lower cholesterol and triglycerides. Statins and other lipid-lowering medications may be prescribed. Treat hypertension. Blood pressure control is important to reduce the risk of further liver damage. Medications. Experimental and off-label. Some medications are being studied for NAFLD treatment, including pioglitazone diabetes drug and vitamin D for patients without diabetes, though these are not universally recommended. GLP-1 agonists like liraglutide, used for diabetes and weight loss, have shown promise in reducing liver fat in NAFLD. Monitoring and regular checkups. Regular follow-up is essential for monitoring liver function, fibrosis progression, and managing metabolic conditions. Advanced cases. In cases of cirrhosis or liver failure, patients may require liver transplantation. Prevention. Preventing NAFLD involves managing the conditions associated with it. Maintain a healthy weight. Weight management through diet and exercise is crucial. Follow a balanced diet. Limit sugar and refined carbohydrates, and opt for a Mediterranean-style diet. Stay active. Regular physical activity helps in maintaining the healthy liver and reducing the risk of metabolic syndrome. Control metabolic risk factors. Monitoring and managing diabetes, high cholesterol, and hypertension can prevent or slow the progression of NAFLD. Prognosis. The prognosis for NAFLD varies. Simple steatosis. Most people with simple fatty liver will not develop serious liver problems. NASH. Around 20 to 30% of people with NASH will develop progressive liver fibrosis, which can lead to cirrhosis and its complications, such as liver failure or liver cancer. Cirrhosis. Once cirrhosis develops, the risk of liver failure and liver cancer increases significantly, and the prognosis becomes more serious. Conclusion. NAFLD is a common liver condition that ranges from benign fatty liver to more severe liver diseases like NASH, cirrhosis, and liver cancer. While there is no specific medication to cure NAFLD, lifestyle changes such as weight loss, the healthy diet, and regular exercise play a crucial role in managing and even reversing early stages of the disease. Early diagnosis and management of underlying metabolic conditions are key to preventing progression to more severe liver damage.